I'm Carol Halland. I'm the Director of Planning and Community Development. And tonight I'm very pleased to announce for you the Thrive program and act as the MC for the panel who is going to present to you tonight. So the purpose of tonight's discussion is to introduce the City Council and the viewers to the Thrive program. Redmond has a history of being creative and proactive with the provision of safety, stability, opportunity, and hope in service to our communities that are in need or are experiencing crisis. And Redmond Thrive program strengthens our community through a targeted cross-departmental actions. Tonight, we're going to hear from a panel of all women, interestingly enough, who are the individuals that provide the drive behind Redmond Thrive. So I am going to introduce them in order. All right, first I'm going to introduce Tisa Rutherford, who is going to describe the city's Homelessness Response program. Tisa?
So good evening, Council. Thank you for this opportunity to provide a high-level overview of the Homeless Outreach Program. My name is Tisa Rutherford. I'm the City of Redmond's Homeless Outreach Administrator. The goal of the Homeless Outreach Program is to assist our local unsheltered and housing unstable community members in achieving stability. So this is done by creating individualized plans to address each individual's needs and providing resources and hands-on support to help individuals as they navigate their paths towards stability. Outreach partners with multiple local agencies to pool resources together, including behavioral health services, employment support, rental assistance, medical referral, legal support, and much more. Outreach also collaborates actively with the Redmond Police and Fire Departments to help connect individuals who are frequent utilizers of emergency services to more appropriate and sustainable resources. So how do we find our clients? In a number of ways. Outreach receives referrals by Redmond Police and Fire Departments, by partner agencies and businesses, through conducting street outreach, by conducting on-site services in the community, such as safe parking sites, the City Hall Resource Center, the Redmond Public Library, and the Together Center, as well as receiving referrals directly from community members. So this could be as simple as you picking up the phone and indicating to Outreach that your family member is struggling to pay rent, or that a person seems to be sleeping in their car behind your apartment complex, and we will respond. We rely on community partnership and we want your involvement. You can help respond to homelessness in Redmond by handing out our business cards or contact information to panhandlers or homeless individuals that you encounter. You can contact Outreach directly if you observe someone possibly needing services. Our business cards can be picked up at the City Hall customer service desk or delivered to you by request. So I wanted to provide some brief outcomes for our program. As of Q3 of this year, so the end of September 2021, Outreach has provided 125 clients with services. 56 of these individuals, or about 45%, have achieved their stabilization goals, and of those, 52 included housing as their goal. Other examples of stabilization goals could include obtaining rental assistance, employment support, help finding a more affordable apartment, or relocating to live with family members. I encourage Council and the community at large to check out the Thrive webpage to read client success stories, learn more tips on what to do or not do if you encounter someone panhandling or discover a camp, and to learn more information about our program in general. Thank you very much.
Thanks so much, Tisa. Yes, Tisa. Next, I'd like to introduce you to the city's mental health professional, Susie Kroll, and she's going to describe her co-responsible role with the police department.
Good evening. I am the police co-responding mental health professional and community support administrator for the Redmond Police Department. My role is one of bridging the gap between crisis services, usually on the worst day of somebody's life. I not only support with my partners the care and referral services for our community members that are suffering from a crisis, but also helping friends and family and loved ones of those that are in crisis navigate systems that can be very confusing. We do quite a bit of crisis intervention and education for the community, as well as service connection and referrals, as well as making sure that there is at least some version of modified case management in the connection and support of those referrals. Meaning I spend quite a bit of time following up with friends and family members and those that have experienced a crisis to make sure that the referrals actually make a connection and that we have a service integration. The other pieces of my role that are quite important for the department are that I participate in a lot of the in-service and law enforcement trainings that center around crisis and de-escalation, as well as behavioral health trainings for our officers and our non-commissioned staff. The other areas where we coordinate well are with our homeless outreach administrator, mobile integrated health, and many of the social services available within the city of Redmond and throughout King County. It's not uncommon for myself and my partners to help engage services outside of the county and in several instances even out of the country. I wanted to share an anecdotal number from data that has been collected. Since February 26th of this year, my partners and I, but more specifically with the crisis intervention and follow-up, myself have conducted 911 case management, follow-up, crisis arrival, and de-escalation calls. So we definitely see the demand and the need in the community and have a solid working connection with a lot of our social services. We bridge the gap between having law enforcement respond to particular crises and making sure that we have the best skill set available. So as the co-responding mental health professional, I spend quite a bit of time, again, bridging that gap and making sure that crisis issues and situations are met with safety and equity for our resources that are available. Thank you.
Thanks so much, Susie. And that's a great segue to our next speaker, who is Liz Downs. She's a firefighter that's stationed at fire headquarters, and she's going to describe to us the Mobile Integrated Health Program.
Hi, my name is Liz Downs. I work for Redmond Fire. I've got to serve the city for about 20 years. I work with my other partners, what are 3 other EMT firefighters, and a social worker who is contracted with the City of Seattle Aging Disability Services. Mobile Integrated Health works with referrals from the citizens, from firefighters and community members. When we make decisions in Mobile Integrated Health, our goals are to try to connect people with the appropriate health and social services to reduce their 911 calls. Our second goal is to keep emergency services, aid cars and fire trucks in service. And then we want to become a role that people can rely on in our community. Some of our best successes are with people, before they even call 911, they recognize that there is an issue and they call, and we can help them get the services before they have that fall in their home, before they break their hip, before they do get to the point where they're homeless, or if mental health or chemical dependency has taken them to a place where they're not stable anymore. Again, we work, most of the clients that we see are over the age of 65. We tend to meet them in a fall capacity. We unpack that fall. That fall could be from blood sugar issues. It could be from maybe in COVID, they haven't been to the doctor, so they haven't had a regular eye exam. It could be that they need a glucometer. So we'll unpack that fall. And the biggest part for us with Mobile Integrated Health is that, as I said, most of our clients are over the age of 65. So we really want to treat our clients with respect and dignity and allow them that process to age gracefully in their home. And we work again with the Redmond Police Department. We work with TISA, with the homeless outreach. A lot of our clients, they'll have overlapping issues. Not only will they have a mental health issue, they'll have a medical issue that'll involve the fire department. And because of their mental health and chemical dependency, their housing might be at risk. So really this team makes it so nobody really slips through the cracks, and that's our goal. So thank you very much.
Thank you, Liz. Next, I'd like to introduce Callista Wellbaum and Judge Michelle Gelson, who are from King County, and they're going to speak to you about Redmond Community Court Program, and we're going to follow that with a short video.
Good evening. Thank you so much for having us. I'm Callista Wellbaum. I am the Therapeutic Courts Manager for King County District Court, and with me I am glad to have Judge Michelle Gelson. She works closely with me in the Redmond Community Court as well, and also does other Redmond cases. So I'm here to talk, like Carrie said, about community court. We have a short video to share, but just so you know a little bit about what we do, we work with individuals who come into court on low-level misdemeanors, and we work to help them receive support so we can address the underlying reasons why we are in the court, and while they are in the court, excuse me. And we also, as part of their time with their court, they get connected to those services, and they do community service with us. So I'll turn it back over for the video.
Thanks, Callista. And we're sorry we can't get a picture up of Judge Gelson, but I'm going to run the video right now.
I have some exciting news. This is our 3-year anniversary for community court. We've had 217 participants that we have served and 135 graduates. What have you gotten the most out of community court?
Understanding that, like, I'm not alone. We can dig ourselves out of a hole that we put ourselves in.
There's people who are out there, who want to see you grow, who want to see you succeed.
You have fully complied with all the conditions that you were required to do. So, Your Honor, at this time, we are asking the court to dismiss.
I worked really hard to get here.
The reward for me is when I hear third parties talking about how good this court does for people, and then having our participants prove to us how good this court does for them.
And your mother was with you. Is she proud of you today?
Yeah, she's happy for me.
I want to thank our community court team. It's been quite amazing that we've been able to continue during the pandemic. It took a lot of work, obviously, to get the Zoom capability and to get our virtual resource center. Has it been helpful to be able to join us via Zoom instead of having to come to court?
Absolutely. Zoom is, I feel, a lot more convenient.
I want to thank everybody that's in our resource center for everything that you do for us and our community. I want to thank Erica and Lista as well. The master of the show is our clerk, Adam. There's so much behind the scenes that you don't see happening, and Adam just does a tremendous job. We also need to thank our prosecutor and our defense attorney, Ms. Peshtaz and Mr. Lotskar, because community court, as you know, is a lot different than traditional court. It's here to support you. That takes partnership.
This program is very fair and very helpful.
Thank you, Callista. And I am going to say for the viewing audience, in case that was difficult to hear, the link actually is live in the electronic materials that you can find in the packet agenda. So if you want to go back and watch that again, you can do that. So back to you, Callista.
No, that's it. That was our presentation. If you have any follow-up questions, you can feel free to ask, and I'll be happy to get back to you.
Great, thank you. And thank you, Judge Gelson. Next, we're going to hear from Brooke Buckingham, who is our Human Services Program Manager and Staff Planning Manager in the Department of Planning and Community Development, and she's going to share information about our Human Services Program.
Thank you, Dr. Holland. Good evening, Council. I'm here to provide a brief overview of the Human Services Program, which is run by a small but mighty team, including myself, Tisa, Alaric Bien, and most recently, Amber Lehman. As you may know, Human Services is guided by the vision and policies laid out in the city's comprehensive plan, and then further informed by a set of strategies outlined in our Human Services strategic plan. I'd like to read a section of the comprehensive plan that I believe really captures the essence of our work. The city works in partnership with schools, service providers, and other organizations and jurisdictions to maintain and strengthen a human services network that provides the food, shelter, job training, childcare, and other services residents need to be thriving members of our community. One of the primary ways that we accomplish this goal is by providing funding to nonprofits so that residents will have access to resources if and when they may need them. The Human Services budget is based on a per capita formula, which is adopted by Council as part of the budgeting process every 2 years. The city works in partnership with other jurisdictions in King County to coordinate a centralized online application for any agency that is seeking city funding. This process will open again in spring of 2022. These proposals are reviewed by the Human Services Commission, who advises City Council on what programs the city should invest in. As you can see from this slide, we've highlighted some of the program accomplishments resulting from these investments. Providers who receive funding are required to report on both the number of residents that they served and the number of services provided. So for example, hours of counseling or bags of food. In 2020, over 14,000 residents were served through nearly 50 funded programs. I want to point out that the data is rolled up data from all of our providers, so we don't have an unduplicated client count, but you can see the impact in our community. The city awarded over $2 million in grant funding. This includes both the annual Human Services Fund, the per capita that I just mentioned, as well as additional money that we received as part of federal COVID response funding. And I really want to take this opportunity to say how fortunate that we are to have such committed community partners like HopeLink, Eastside Services, ICRON, and Congregations for the Homeless, just to name a few. There's many who are working tirelessly to serve our community. Hold on just a second. They are the reason many of our residents are able to move from crisis toward stability and thriving. Last year, all of our local agencies were able to quickly modify their program operations and continue providing the same level of services, and in many cases expanded their services to mitigate the impacts of COVID. So that's a snapshot of the Human Services Program. But before I close, I wanted to let anyone who's listening know that we are currently in the process of updating our Human Services Strategic Plan, and we welcome your input. This will help us plan for human services over the next 5 years. And there's a question online. There's a questionnaire online, and it closes this Friday. And you can find that at www.letsconnectredmond.gov/human services. Thank you.
Thanks so much, Brooke. And then last but not least, Amanda Demmel is going to speak to the senior and teen services at the city and volunteer opportunities that are available.
Thank you. Good evening, everyone. My name is Amanda Demmel, and I am the new Recreation Manager as of June 2021, and I oversee the Recreation Division in the Parks and Recreation Department. Tonight, I'd like to highlight the human services we provide, specifically in our teen and senior sections. We offer nutritious meal programs to both seniors and teens, and we also offer a thoughtful and strategic array of community programs and resources for our teens to connect with to support their overall health and well-being. First, looking at our lunch programs, the Senior Curbside Lunch Program is a service that is currently replacing the daily hot lunches that were served in the Senior Center in partnership with Catholic Community Services prior to the building closure in 2019. This free service is offered twice weekly and serves over 115 meals per day. This service is funded through Human Services and the Mayor's Grant. Next, we have the Senior Meals on Wheels program. In partnership with Sound Generations, senior staff and volunteers deliver Meals on Wheels every other Wednesday to over 20 homebound seniors in our community. This program has continued throughout the closure of the Senior Center and during the pandemic. Last, we have our Teen Summer Lunch program. This is a lunch program in partnership with Redmond United Methodist Church and Open Kitchen. It was offered 3 days a week in the summer to replace the free and reduced lunch program that is available during the school year. This service is currently paused due to the pandemic, but we hope to bring it back just as soon as it's safe to do so. We also offer wellness check-ins and intergenerational connections. Social and community connections are extremely important for both our seniors and our teens. For seniors, social bonds are created and maintained through the lunch programs, but also through general wellness check-ins. Whether it be celebrating birthdays or offering support during a hospital stay, we are committed to caring for the whole person. For the teens, RIPAC, which stands for the Redmond Youth Partnership Advisory Committee, is a great social connection for members as well as an opportunity to span generations. Currently, our seniors and our teens have partnered to do gardening projects, creating unique and rewarding intergenerational connections. Creating and maintaining community connection for our teens is also a very important priority. We connect teens to community resources such as Friends of Youth, YES, Youth Eastside Services, and Methodist Church programs, among others. We also connect teens in crisis with appropriate local resources, including mental health and social services. We provide a consistent presence and a space for gathering, social connections, support, engagement opportunities, college prep, counseling referrals, and case management. We also offer educational opportunities to assist teens with development and making positive choices. Thank you.
And then did you want to speak to the volunteer opportunities too?
I would love to, thank you. Lastly, I'd like to touch on the multitude of ways for community members to get involved citywide with our volunteer opportunities, which include a variety of areas of interest and commitment levels. Opportunities exist such as serving on boards and commissions or working specifically with the environment and Green Redmond, events, public safety, senior programs, teens at Farrell McWhirter Park Farm or the Old Firehouse Teen Center, and the police department. Additionally, there are a variety of nonprofit volunteer opportunities available as well. The agencies listed on our website receive direct funding from our city's Human Services program. More details can be found at redmond.gov/thrive for those interested. We would love to have you join us. Thank you.
Thank you so much. And thank you to all the women who participated in the panel this evening. I just wanted to say how inspired I am by all of the women and the dedication they pour into their individual programs to create the holistic program that we refer to as Thrive in Redmond.